I wanted to bring today's episode to the podcast talking about the functional approach for POF, POI, low AMH, diminished ovarian reserve, really digging into what are some healing opportunities that have been missed. If you've been told that donor eggs are your only option, this episode is for you. We are taking your questions and we are going deep on each of them. So excited for you to listen. I'm so excited to announce that registration is now open for our Step Into Your Power course. This is a 6-week live online group program. So it doesn't matter whether you're 28 or 38, you're already ready to have your baby. You just wish that your body would catch up. And you may be feeling impatient, frustrated, which leads to you trying to plan and control every aspect to make it work. I have partnered with a therapist/shaman to develop this course. As a recovering type A, I know what it's like to keep pushing, controlling, planning, and feeling like the uncertainty will literally drive me crazy. This course will include strategies to help you shift from worry, constant controlling, and planning the timing to a deep and powerful state of knowing that you will have your baby. If you knew the soul of your baby is waiting, how would you approach this journey differently? Class starts in early September. Base is very limited to 12 people. Go to the show notes to register your spot. And as this is the first time we're offering the course, there's a special price. Plus there is a VIP option as well. So go to the show notes to register, and registration closes on Tuesday, July the 21st at midnight Pacific. Hey there. Thanks so much for listening to the Get Pregnant Naturally podcast. And I've got a favor to ask you. If you are enjoying learning about the functional approach to fertility, consider going to iTunes and rating and reviewing the podcast. This is how it helps the show reach more people that are struggling with infertility, knowing that there's another approach that really can get to the bottom of why it's not working in the first place. So all you need to do is, if you're on the app or the desktop, just go in and consider leaving a 5-star rating and leave a review. And there is step-by-step instructions in the show notes showing you exactly how to do that. So if you can just take a few minutes, just take the few minutes right now. You can pause this recording, come back, leave the review. It would really mean the world to me and help others that are on the fertility journey as well. Take care. Hey there. I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers, and really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, F-A-B, fertile.com and click on book a free call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, F-A-B, fertile.com, and click on book a free call. One theme that keeps coming up with the couples in our Fab Fertile couples coaching program is sleep. Whether it's insomnia, having a hard time falling asleep, waking up at night, or feeling tired when we wake up, sleep is critical for fertility and hormones. And that's why I'm so excited to have Blue Blocks as our podcast sponsor. So we're exposed to blue and green light from our phones, our tablets, our computers, indoor lights, and more. And this exposure impacts our melatonin production. And melatonin is essential for both female and male fertility. It helps determine the frequency and duration of our cycle and impacts sperm. There's lots of blue light blocking glasses on the market, but the ones from Blue Blocks, they've actually compared other popular brands, and Blue Blocks block 100% of blue and green light, while other brands fall short. So I have their sleep glasses. They have red lenses, and the ones I have are a little translucent frame, and they're so stylish and really cool. And so they eliminate 100% of the blue and green light in the 400 nanometer to 550 nanometer range. So this is the exact range that has been shown in clinical studies to disrupt melatonin and negatively impact your sleep. So all you do is wear your sleep glasses after sunset until it's time for bed, and you'll notice improved sleep after just one use. And it's also cool to use when you're flying for managing jet lag. So I got to say I was a little skeptical about the noticing improvement after one use, but literally I use these glasses and my sleep is actually already pretty good. I used them for one day, and I have to say after one day, I had the best sleep of my life. I just felt so rested. So these glasses, they ship free and they're tracked for all orders anywhere in the world. And also they have all their frames come in prescription, non-prescription, and reading glasses. Plus you can send in your frames and they'll add the blue light blocking and green light blocking lenses to your frame. So this is an easy hack that you can add to your fertility toolkit. All you do is go to BluBlox, BLUBLOX.com. Use the coupon code GetPregnantPodcast at checkout and receive a 15% discount. That's BluBlox, BLUBLOX.com, and use the coupon code GetPregnantPodcast to receive your 15% discount. I didn't need to go to donor eggs. Obviously, I don't regret it. I have beautiful children. I could have done things differently, restored. I was still cycling back in my 20s. I could have looked at my health, the environmental toxins, the stress I was under.
Many women are being told their eggs are too old. That's often merely an assumption that's not based on actual evidence. The reason being that there is no direct test of egg quality. You can't test egg quality.
It's the man who's got a food sensitivity or he has a zinc deficiency.
Like there can be a root cause to these symptoms that are, quote unquote, period problems, that the doctor will pass you a pill without any question of why.
And some part of you knows that if you can reframe your journey from not one of struggle, or if it is struggle, learn how to embrace the struggle. Learn how to embrace it.
Most conditions in the child occur during the 9 months of development. It's the genetic switches are turned on or turned off, and they're pre-programmed. So you are in such a powerful, amazing position to do amazing things for your kids.
Why is IVF the first step? Because we believe it should be the last step. Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone struggling with infertility, and my aim is to help you get pregnant naturally. Today, I'm welcoming Justine Altman to the podcast, and we're digging into your questions. So Justine Altman is joining our team as a functional and diagnostic nutrition practitioner, and Brandy Busco is still with our team, and she's transitioning to our clinical advisor. So excited to answer your questions. But before we do that, definitely check out episode number 6 for a functional medicine 101 talk. Plus, we look at some of the tools that we use to help couples conceive. So Justine is part of my team here at Fab Fertile, and she's an integral part of our couples coaching program, which uses functional lab testing, diet, and lifestyle changes to dramatically improve the chances of conception. So if you're struggling with infertility, your body is desperately trying to tell you something, and focusing on your health will either help you get pregnant naturally, or if you do need to go to the fertility clinic, you'll improve your chances of success. So Justine is a functional diagnostic nutrition practitioner, and she's experienced her own journey with infertility, having PCOS, and was able to have 2 children. So excited for her wealth of experience and knowledge in the nutrition and the functional space, and excited for her to join our team. And so thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Justine, excited to have you on the podcast.
Hey, Sarah, thanks so much. I'm really excited to be here today.
Awesome. If you could share your journey, really how you came to do this work.
Yeah, I would love to. So my journey started when my husband and I wanted to start a family, and I was having trouble trying to conceive. I had had PCOS for a long time, and so I knew it was going to be a challenge for me. And I saw a reproductive endocrinologist who suggested that I try acupuncture. So I did give that a try, and we tried some supplements. But eventually, after no success, the acupuncturist basically said, Justine, there's nothing I can really do to help you unless you sort of get your game on track, right? So you need to learn how to eat real food and how to really support your body naturally, or there's no progress that we're going to be able to make here. And so I did. I sort of dove in head first and really made radical changes to the way that I was taking care of myself. And I really started to feel much better very quickly. We did a couple of rounds of Clomid, which actually didn't work for me. I did, I think, 3 months on Clomid. And then we did 1 month on Femara, and I got pregnant right away without having to have the shot to cause ovulation to happen. So that's essentially the beginning of my story. And from there, I just continued to apply natural methods to continue to just get healthier and healthier as time went on. And then a few years later, I did get pregnant naturally without even trying really for my second baby. And so now I have 2 beautiful, healthy children.
Nice. And you discovered FDN kind of in that whole journey then as well?
I did, yeah. So along the way, so, as soon as I started to really get better from making some diet and lifestyle changes, I was sort of hooked, because before then, I had always thought that I was just sort of dealt a bad genetic hand, and that I had no control over all these things that were happening to my health. But now I was hooked. So I really sort of dove in and started listening to educational talks, basically sort of nonstop while I was at work during the day, and stumbled upon functional diagnostic nutrition and doing some lab testing to sort of dig in deeper at the biochemical level to find out what's going on in the body. And from that point, all the pieces started to come together for me. And as I peeled back the layers of the onion, essentially all of my health issues just sort of faded away.
I love it. I love it. Yeah, I find most people that come to this work, there's usually a personal health journey. It's kind of like you had to hit rock bottom, unfortunately, and then you're like, oh, wait a minute, and then you discover this, and it's like, why doesn't everybody know about it?
Exactly.
Yeah.
That's why I do this work these days, is because I just want to shout it from the rooftops that we don't have to suffer that way.
Okay, so today we're going to be digging into your questions, and we're going to be starting with Juliana. So she's got a question about, so she's got premature ovarian failure, low AMH, and wants to know our thoughts on platelet-rich plasma, so PRP for the ovaries, and also about DHEA. So, I'll just do a little disclaimer first. So first of all, please refer to the disclaimer at the end of the show. We are not doctors. Be sure to consult with your physician before making any of these changes. And our goal is always to educate you so you can be empowered to know there are many changes you can make before you go to the clinic, the fertility clinic. And you don't need to wait for them to open. Obviously, some of them right now are in the middle of opening, but can be some delays as we're recording this in July. So with that ovarian rejuvenation, it's still experimental, may not be covered by insurance. And Justine's going to talk about, it can be very invasive and cause stress in the body. So you want to talk a little bit about that first, Justine?
Yeah. So it's an invasive procedure, right? There's a needle involved, and they have to numb up the area. And there's, in my experience anyway, when I went through some of these kinds of procedures back when I was trying to conceive my daughter, there's really sort of some trauma involved, right? Even if you're feeling pretty good about it and you go into the appointment and you're not feeling sort of emotionally charged, I certainly walked out with tears streaming down my face and sort of couldn't control it, because it felt like a traumatic experience, and it felt like this sort of laboratory setting, and it sort of just wasn't, it wasn't the way you want to feel when you're trying to create a baby. And so in my opinion, that's a stress on the body, right? And so everything that we talk about usually in trying to create fertility naturally is about minimizing stress on the body. And so in my opinion, a procedure like this really is just another stress on the body that actually, in a lot of cases, can sort of take us further away from our goal of creating a baby.
Absolutely. Yeah, our thing is to reduce the stressors. So reduce the physical stressors such as food sensitivities, gut infections, address the environmental toxins, really address the mental emotional side of things. If there's any structural stress, such as a pinched nerve or adhesions or scar tissue, to be able to address those. And so, is this causing additional trauma? I think there's other steps to take for premature ovarian failure before doing that procedure, because most times your RE, if you have POF, the main recommendation will be donor eggs. And we've helped people with premature ovarian failure and low AMH get pregnant naturally, or if they do go to the clinic, it's actually worked for them. It's not the case for everyone, but to me, what else is going on in your body? And we will do the question about DHEA, and this is typically recommended for diminished ovarian reserve, low AMH, typically when you're preparing for IVF. So it can help decrease miscarriage by increasing the number of chromosomally normal eggs. And also, if you're a poor responder, it can be helpful. And usually they're doing DHEA with Clomid as well. And so these are some of the recommendations too. Definitely check out the episode I recorded with Brandy about what to do next after reading It Starts with the Egg. So she's talking about DHEA, and we're taking a functional spin on that book. Typically, people are not getting their women are not getting their DHEA tested. We are definitely testing that with the Dutch test, and that's digging in further exactly which pathways the hormones are going down and what's actually happening with your hormones. Can you talk a little bit about DHEA and your take on that, Justine?
Yeah, so DHEA is sort of a master hormone in the body, and it's sort of the opposite of cortisol. So cortisol being our stress hormone, and it's really important that we have a balance between these two hormones. And when the balance gets off, then other things get off, right? So our circadian rhythm can be thrown off. And so we have this rate of sort of cellular breakdown in the body that happens naturally. And we need cells to sort of break down at the same rate as they're building up. And so cortisol sort of breaks down cells and DHEA sort of builds things up. And we need that to be happening at the same rate. Body's not breaking down. And also the body's not sort of growing too fast, right? Because that would lead to things like cancer if we have cell growth that's just sort of out of control. So it's really important that we have a balance between those two hormones. And that's why we run the Dutch test, is because that really gives us a really accurate picture of exactly what's happening with your DHEA and exactly what's happening with your cortisol. And that really makes sure that that as you're supplementing with DHEA, that you're not sort of overshooting your target. So, if we don't know where you're at when you start and we don't know where you're at throughout, then we really don't know whether the DHEA is actually helping or making the problem worse if it's driving a bigger imbalance between those two hormones.
Yeah, because there can be those side effects from DHEA, like acne or oily skin, oily hair, hair loss. To get the amount right, and we don't know exactly where your levels are. And typically, your physician is not. Whenever I've spoken to someone, they're typically not getting it tested once they're, because it's like that first line of defense. Oh, you have POF or you have diminished ovarian reserve, low AMH. Let's give you DHEA to go ahead. Also for POF from a functional side of things, we're going to have you do the elimination diet, taking out the top allergens, and then really tweak that further with food sensitivity testing. We see a lot of people with POF, low AMH, diminished ovarian reserve with non-celiac gluten sensitivity. So very sensitive to gluten, so sensitive that we recommend the whole household going gluten-free. And then typically with the elimination diet, we'll have you and your partner do that. And then we'll dig in further with the AIP diet, so the autoimmune protocol diet, to even take the further burden off the body with the AIP diet. Anything you want to say on the AIP, Justine?
Yeah. So AIP is typically my go-to for anyone that I'm working with, for fertility or for any other health issues, because really it just, we've got this sort of inflammation fire raging in the body. And what AIP does is it eliminates, like you said, all of those inflammatory foods. And we find that it just sort of acts as a total reset for the body. And now your body can start to push out any toxins that have been there. And it can start to do things, sort of mechanisms within the body, all the things that your organs and your systems are supposed to be doing. They can start doing that because now they have the resources to be able to apply to sort of all of those body systems, and the body just starts to work in harmony.
Yeah, definitely check out Getting Pregnant Naturally with AIP diet on the podcast here. And it goes through exactly what the AIP diet is and what you're taking out of your diet. So you can listen to that. But there can be studies saying, or this may be more anecdotal information, that POF may be autoimmune. So that's why the AIP would be a good recommendation. So more anecdotal information on that, because it's still early days. But we've had people going AIP and getting pregnant naturally. So definitely some things to look into from a functional standpoint. I think the other side of things with the PRP would be after you've done all those things. Okay, so the next person we have is Norita. And so she's 35 years old. She's diagnosed with diminished ovarian reserve last year, and she's been trying for about 9 cycles. She's never yet had a positive pregnancy test and over 20 cycles of trying. And based on tracking her cycles, which are shorter, they're about 24 days. She also ovulates too early, usually around day 10. But her luteal phase is good. So she's thinking her eggs are too immature when they ovulate, so they don't get fertilized. That's her kind of question. And now just some more information on her. So she has digestive issues, and doing the elimination diet would benefit her, but she's concerned that she can't afford to lose weight. So most women who have tried these diets, they also lose weight. So this is her concern. Ideally, she'd actually benefit from a 10-pound weight gain, she tells us. So her husband's been tested. He came back fine. She's at the high FSH, low AMH. Of course, the RE has only said that her only option is donor eggs or adoption. Again, that's to me the last resort. Obviously, it's the last resort for anyone. For me, I got diagnosed with premature ovarian failure and I went straight to donor eggs. But years later, food sensitivities, gut infections, chronic stress. There's lots of things for us to dig into. For her, IVF was not considered. As you said, her chances would be very low, and he didn't want to put a financial burden on her. So digging into to me, they're obviously with diminished ovarian reserve, we're looking at those stressors again, kind of like a broken record here, but the functional approach, we're digging into why and digging into addressing the stressors, the physical stress, such as a food sensitivity, a gut infection, the environmental toxins like your plastics, your personal care, your making sure you have filtered water, and then the mental emotional stress and the structural stress. For this, with the concern of losing weight, we see a lot of people with POF and low AMH and diminished ovarian reserve that they don't want to lose weight. And so those BMI, like if you are underweight, so underweight's considered a BMI of 18.5. You just go to a BMI. You can go to BMI calculator by Googling it, and you can see putting your weight and height, and it tells you if you're underweight. So definitely you want to make sure that you're not under fueling, over exercising. But there could be some issues we're going to talk about here as to why you are underweight to begin with, which may be a clue as to looking at your hormones and with the diminished ovarian reserve. So to us, that's a clue for us to dig deeper. Is there underfueling? Is there overexercising? And also malabsorption with low muscle mass, if that's the case for you, if you're thin but don't have proper muscle mass. And these are some things that we're seeing a lot too with people with low ovarian reserve or diminished ovarian reserve, low AMH. So if you've been on long-term birth control, you may have been tested for celiac, but there's the conventional test is only looking for 1 to 4 markers for celiac. There's a lot of false positives. We use the Zoomer food sensitivity test. So it's looking for about 26 proteins and gluten, and a high percentage of people we work with are coming back with this non-gluten sensitivity. Are there gut issues such as SIBO or H. pylori, low stomach acid, adrenal dysfunction, hypothyroidism, which we see a lot where the thyroid is off, and autoimmunity. So those could be some issues of maybe why you're underweight to begin with. Justine, what would you like to add to that? This is Justine's expertise.
So there are so many reasons, right? It all boils down to stress on the body in one way or another. In general, right, so I've seen with the elimination diet, I've seen people like lose as much as 40 pounds in the first month if they have a lot of weight to lose. But I've also seen people put weight on if they had weight to gain. So essentially what this diet does, again, it's about reducing inflammation. So it's not about reducing how much we're eating. It's just about controlling what we're eating so that we're not eating things that are causing inflammation on the body. And when that happens, the body starts to sort of do the things it's supposed to do naturally. This diet seems to work for people to balance their weight, to put their weight where it's supposed to be, regardless of whether they're underweight or overweight at the moment. But one thing that I will caution you about is that it's really important that you make sure that you're eating enough, right? That we're not under eating. And in general, so it's everyone sort of has a little bit of a different calculator, but you should be eating 12 to 15 times whatever your ideal body weight is in pounds in a day. And that should be the calories for the day. And, we don't calorie count a lot because, again, it's so much more important that you're eating the right foods rather than, sort of controlling your portions. But it's useful occasionally to do a little bit of calculation to sort of log the food that you're eating to find out whether or not you're eating enough. Because if you're not eating enough, the body believes that you're going to starve, right? Or at least it believes there's some kind of famine, some kind of food shortage. And your body intentionally slows your metabolism down, slows all the processes in your body down because it's trying to protect you, right? It's trying to make sure that you are conserving fuel so that you have it in future days if food doesn't become available. So it's really important that you don't undereat. It's also really important that you make sure you're eating plenty of healthy fats, right? So fats for many, many years have been villainized in our society, but fats are super important. They really do a good job taking care of the body. And this is true whether you're underweight or overweight, that you need lots of healthy fats. It's really important, especially for hormone balance as well, right? Our body synthesizes our estrogen and progesterone from healthy dietary fats and from vitamins. So if we don't have enough fats, our bodies can't produce the hormones that we need in order to have a healthy cycle.
Yeah, absolutely. And I think that, as you say, that villainizing fats, and for years I did the low fat yogurt and all those different things. And now it's like I've got avocado oil and avocados and, seeds and nuts and all those things to add to my diet. So you can do the elimination diet and it's not about starvation. It's not about you losing weight. So anything specific there for the elimination diet to make sure not to lose weight? Anything you wanted to dig into for her?
Yeah. So I would love to talk to you about the gut, right? So, in general, when we take a bite of food and we chew it up, it mixes with our saliva, and that's the first way food starts to break down. And then it ends up in our stomach, right? And it gets sort of bathed in stomach acid, and that breaks down food further. And then it moves a little further down and it gets bathed in bile from the liver, which drips bile into the gallbladder, and that breaks down our fats. And now it's in our small intestines, and that's where we absorb the vitamins and minerals and other nutrients from the food that we eat. If anything is sort of not tip-top shape about that whole process, right? So if we eat too fast, we don't chew thoroughly enough, or if we don't have enough stomach acid, maybe we've taken acid blockers over the years, or if maybe we've had an infection like H. pylori, we know lowers stomach acid, isn't broken down enough when it gets to the small intestines. And if the particles aren't small enough when it gets to the small intestines, it can't be absorbed into our bloodstream and we can't use those nutrients. And so instead, they just pass through us as waste. And so it's very possible that even if you're eating a really nutrient-dense diet and you're eating enough food in a day, the right amount of food for your body size in a day, that if there's anything sort of impaired about the digestive tract, that we're just not absorbing enough of the nutrients. And so we can be malnourished even if we're eating enough. So it's really a matter of, the way we see it is doing some testing to sort of dig in and find out, are there limitations to the digestive tract, right? Do we not have enough stomach acid? Is there malabsorption going on? Are we breaking down our fats and our proteins well enough to be able to absorb them and utilize them? And sort of all of those things, because there are sort of so many steps along the way in absorbing nutrients from our food that can go wrong. And it doesn't take a lot for us to sort of start to repair that and to really get it back on track so that you're making the most of everything that you're taking in.
Absolutely. So yeah, as I say, we're doing the food sensitivity testing, the hormone testing, stool testing, and hair testing. So really digging in with the testing, what has been missed, but definitely with the elimination diet too, there's not about you losing weight. It is figuring out the gold standard to figure out food sensitivities, and then making sure that you're adding additional healthy fats. And you can also add starches too. Anything there with the fats or starches?
Yeah. So I hear a lot of times that people aren't really sure what healthy fats are. And so I would love to just rattle a few of those off real quick.
Sure. Yeah.
So in general, healthy fats are olive oil, coconut oil, any meat fats, if they're meats that have come, that are from animals that have been raised in a healthy way, right? So organic or pasture raised or cage free, or sort of any of those other fancy words that tell us that whoever the manufacturer was, that they really cared about their animals. And then avocados and avocado oil, and then some things like ghee and MCT oil, and sometimes butter, if you tolerate butter, and essentially if you tolerate the fats from dairy products well. And bad fats are basically anything that's marked vegetable oil or canola oil, or any of the seed oils, or any oils that have been used, exposed to heat for a long time. So basically any deep fried foods, those are bad fats. And then there's one caveat which people miss quite often, which is that butter and olive oil are both really useful fats for the body. They're really healthy for the body. Olive oil is maybe one of the best ones out there. But olive oil and butter both go rancid at normal cooking temperatures, so it's not ideal to cook with those oils. So in general, we want to include lots of olive oil, and again, butter if you tolerate it, but we want those things to be toppings, basically, right? So you can add olive oil on top of a salad to make a salad dressing, or you can add butter on top of food after it's been pulled off of the heat. But essentially, we don't want to cook with those fats, or they become unhealthy fats. They become rancid for us, and then they're no longer useful to the body.
Yeah, I used to do that for years. I was cooking with olive oil. Now, no longer. Just put it on my salads and on if I make any of those, any bowls or anything that I like to eat. But yeah, definitely I cook with avocado oil now. Even coconut oil can go rancid at high temps too. Yeah, so now let's do our next question then, Instagram. So what's the evidence behind natural killer cells? So I do encourage you to listen to the episode with Monica Cox, who is one of my fertility besties. She recorded the podcast episode with me, Getting Pregnant Naturally with AIP. She struggled with infertility for 9 years, and she had natural killer cells. She did the paleo diet, that didn't work, and then she switched to the AIP diet, and that worked. And she has 2 children, one naturally and one with IVF, 2 little boys. And there's also some studies I interviewed for the podcast from the Journal of American Medicine, talking about the efficacy of the AIP diet for if you have Hashimoto's. So there was 18 people in the study. One person had to leave the study because after 8 weeks, she got pregnant naturally, and the rest were all able to improve their lifestyle markers while doing the AIP diet. And then also a separate study for IBD for colitis and Crohn's. And there was 11 people in the study, so still a small study, but 75% of them were able to go into remission, and they'd had colitis and Crohn's for, I think it was an average of 17 to 18 years. So this is long time sufferers of IBD, and how the AIP diet was more effective than medication. So definitely the AIP diet is awesome. So I would encourage there's some people that say go right to the AIP diet. We typically have to do the elimination diet because it can be, depending on where you are, it can be difficult to do that first. Some people are like, just rip the Band-Aid off and let's just do AIP right away. But definitely for natural killer cells, if that's what you have, to consider making some changes to your diet and digging into gut infections like we've talked about as well. Anything else specifically on natural killer cells, Justine?
Yeah, just that, it's one of those things in the body that, right, so everything in the body can get sort of thrown off if things sort of aren't working in harmony. And so again, as always, so I'm always a broken record, but it always comes down to stress, right? How much stress is on the body? Stress from, the wrong foods, stress from inflammatory foods, stress from foods that we might have sensitivity to, stress from any medications that we might be taking, stress from not enough sleep, stress from not enough exercise or too much exercise or the wrong exercise for your body right now, mental, emotional, daily, day-to-day stress with relationships or finances or, work stress. All of those things play a role on the body. And the way that I see it is that, natural killer cells can be affected by that stress just like anything else, right? Just like having digestive symptoms or, skin issues with acne or muscle aches or headaches or any of those things. It all boils down to how much stress do we have on the body. Like Sarah was saying, the AIP is recommended because it really does a really great job of really, really rapidly reducing a significant amount of stress on the body. And so we see tons of wonderful things that happen even in just as short as a week or two on being on this diet, the AIP diet or the elimination diet, that people have radical changes happening in their body where all of a sudden their skin starts to clear up, their energy is through the roof, their digestion is so much better. And lo and behold, they get pregnant even if they weren't trying at the moment. So we've really just seen magical things happen with that. So as always, my preference is always to try to reduce stress on the body first before we ever pursue any of these sort of on the sidelines, more invasive procedures.
Okay, so next question we have from Instagram is, do you see common themes among couples unexplained infertility? So Brandon and I actually just recorded a whole podcast episode on unexplained infertility. It'll be coming out shortly, so stay tuned for that one. So this lady has unexplained infertility, secondary infertility, and wants to know what she should try before IUI and IVF. From a functional standpoint, there's lots to definitely look at. Again, the broken record, but we're going back to addressing those stressors, food sensitivities, having both you and your partner do the elimination diet, addressing gut infections. We see regularly unexplained infertility with people having multiple parasites, bacterial infections, fungal infections. You see H. pylori quite a lot being passed back and forth between partners. So if one partner has it, you need to do the protocol for both partners because it's passed via saliva. Again, a stressor on the body, the environmental stressors. So, is your partner keeping his phone in his pocket? So the EMFs that are impacting sperm health, looking at your plastic, switching to organic, looking at your personal care products. We're exposed to over 85,000 chemicals per day. So what are we putting on our body? Being able to reduce that toxic burden is key. And then also, I'm not sure how long you've struggled with secondary infertility, which is people kind of think, oh, you should be grateful you already have a child. But secondary infertility can be, just as painful, even more painful, because you envision this little person being in your family and they're not there. And so getting honest about those stressors are key. We're looking at blood chemistry review for both partners. We're regularly seeing thyroid issues that have been missed. Hypothyroidism or subclinical thyroid issues where it's not the actual thyroid, but it could be conversion happening in the gut or the liver. Low vitamin D, we see this all the time. People are supplementing, but why is the vitamin D low to begin with? Another huge clue is if you've been on long-term birth control, so a long-term hormonal birth control, which then predisposes you to food sensitivities, gut infections, and that malabsorption that we were talking about, eating that nutrient-dense diet, but you're well-fed but undernourished, and then blood sugar imbalances. Anything else, Justine, that you're seeing there with unexplained?
Yeah, so you sort of covered it. That the things that we see the most often. You talked about gut infections and H. pylori, and we know that H. pylori reduces stomach acid. The other gut infections that we find pretty often in the gut, right? So again, it's about how well we're absorbing the nutrients from our food, because basically the food that we eat and things that we put on our skin, plays a little role, but primarily all of the fuel that our body ever has to do anything, right? To make a baby, to produce hormones, to do any process in the body is fueled by the food that we eat. And if we're not getting enough out of the food that we're eating, then we just can't do all the things we're supposed to be doing. And when we have gut infections, right, we can eat, again, all of the nutrient dense foods we want and eat plenty, but basically those infections, they do damage to the gut, right? And they sort of crowd out the good bacteria that are supposed to be in our gut, right? The good healthy flora. And when that happens, our body just can't absorb the food the right way. And it causes more issues, right? Because now we end up having things like leaky gut, which allows particles to get through that aren't supposed to get through. And that sends our immune system sort of on high alert. And over time, so at first our immune system is sort of all the little soldiers are out there sort of going crazy, trying to clean up shop. And then eventually the immune system just sort of can't keep up anymore. And so we've got sort of these autoimmune issues that creep up, and now we've got lowered immunity, right? And so now we're more susceptible to more infections in the gut. So it's a matter of sort of breaking that cycle, right? Because if we've got gut infections, there's no amount of good, healthy eating and good lifestyle habits that are going to completely get you all the way there. You've got gut infections because they continue to do damage to the gut, right? So we've got to eliminate the infections, or at least get them to a low enough level where the good flora can really flourish, so that we can really digest and absorb our food really well. And so that the good bacteria are producing the chemicals in our body that are supposed to be there and that help fuel the rest of the processes that are going on in our body.
And I've had this where I had leaky gut. So a lot of these things I had H. pylori, I had bacterial infections like streptococcus, I had fungal overgrowth, I had food sensitivities, obviously, diagnosed with premature ovarian failure. And then years later, all these chronic infections in my body. So I remember doing a food sensitivity test. The whole thing came back lit up that I was intolerant to all the food I was eating. I literally wanted to throw the test in the garbage and give up, but I persevered. But yeah, so I had leaky gut. So as I started to address the infections, the gut infections, and really start to heal my gut, I could then bring those foods back in. And, I was on long-term hormonal birth control because for me, when the periods went off, they gave me the pill. It was a Band-Aid approach and didn't get to the root cause. I was on like heaps and heaps. This is like, when I look back, I can't believe what I was doing. Heaps of antibiotics for the bladder infections, the sinus infections, the yeast infections. That then contributes to leaky gut and also chronic stress. I was like planning, controlling, trying to do it all. That chronic stress on my shoulders were always at my ears. So all those can then impact, lead to leaky gut, intestinal permeability, and then lo and behold, your body mounts an immune response, and then you could be dealing with some issues. So people that are listening to this podcast, you're dealing, for you, the genetic weakness is infertility. Other people, it could be a whole host of other things. So it is to dig further with unexplained infertility, and excited for you to listen to the Explaining Unexplained Infertility podcast when that's coming out shortly. And the next question we have is seeing a functional doctor. So this woman, she's from Instagram. So seeing a functional doctor, she prescribed metformin, but she's not insulin resistant. So that's an interesting one. So it might have been prescribed. There's evidence that metformin can be prescribed for weight loss. Yeah. So even if you don't have diabetes or pre-diabetes, so perhaps that. And also it can reduce. So metformin reduces blood sugar levels and is approved by the FDA for type 2 diabetes, and also can be helpful for women with PCOS. But and also it can be used with together with Clomid. It'd be interesting to see why, if you don't have insulin resistance, unless you're going to do a fertility treatment and maybe you're taking Clomid, why metformin was prescribed. What's your take, Justine?
Yeah, so I've come into contact with a handful of clients who have been prescribed metformin even when they didn't have blood sugar issues. And I've definitely seen it in cases where they had a history of PCOS, but we had been working together for a bit, and the blood sugar really had been managed and the insulin had been managed at this point. And so blood sugar was completely stable and completely normal, but now they were ready to have a baby, and began to see a doctor, to work on that essentially. And the doctor prescribed metformin because that was just sort of the standard of care. That's sort of like, if you have PCOS, then we recommend metformin, because we know PCOS is a metabolic disorder linked to insulin resistance. In this particular case that I'm thinking of right now, it was a situation where, because her blood sugar was balanced and she tried the metformin, that it drove her blood sugar so low, she really felt rotten on the metformin, and was having blood sugar swings and dips, really. And it was causing headaches, and it was causing back pain and sort of a bunch of side effects. And so essentially, she eventually decided on her own, well, you know what, I want to give it a shot without the metformin and see how I feel. Basically, as soon as she stopped the metformin, she felt so much better. And the reason is that if your blood sugar is dipping, right, we want your blood sugar to be relatively low, right? We want it to be nice and balanced. But if it starts to go too low, that's a major stress on the body. That's like a mini trauma happening to the body. So while we've seen metformin be really useful in certain cases, it really needs to be sort of right for you, right? And so it's only if you have some insulin resistance or some blood sugar issues, or both, basically, that metformin seems to be appropriate. And so I'm not sure in your case, we are not doctors, so we can't recommend for you to take it or to not take it. That's between you and your doctor, of course. But essentially, to make sure to check with your doctor and to say, like, is this really right for me if I'm not having insulin resistance issues? Because I certainly have seen it really sort of impact someone in a negative way when it sort of wasn't the right medication for them. And this client, lo and behold, did come off the metformin, and the very next cycle got pregnant. So it certainly is a situation where the metformin isn't necessarily required depending on what your situation is.
Yeah. And then those side effects from metformin, I think a lot of people experience nausea or stomach issues. Anything there you want to say? Yeah.
And this particular client had tons of stomach cramping, where she thought it was really bad menstrual cramping. And the more we talked about it, and as time played out, we did discover for sure it was the metformin was causing a whole bunch of intestinal cramping for her. It just wasn't right. I know in her case, even though blood sugar appeared balanced and her doctor knew this, and she had lost a significant amount of weight, and so was at a healthy weight, the doctor still thought that the metformin would be useful in reducing her testosterone, which she thought was going to be a factor in preventing pregnancy from happening. And so we don't know. That never got tested. We don't know whether or not it actually did reduce testosterone. But what we do know is when she came off of the metformin, that's when she just felt herself again, and her energy was through the roof. And she really felt great, and then and got pregnant by accident, actually. So we know that her system sort of really sort of bounced back and did what it was supposed to do. The other thing with metformin, right? So again, that's between you and your doctor, but it certainly is an option to do the natural things that we recommend, right? So get your diet and on track, and your sleep and your exercise and reducing stress. And there's a very good chance that you may not need metformin at all, even if you do have a history of PCOS or challenges maintaining your weight.
Is that something that you were recommended when you were?
It is, yeah. So I did take metformin myself when I was trying to conceive, and it made me feel crummy as well. Quite a severe of a reaction to it. But I don't know whether or not it helped. There's a possibility that it helped in my case. I actually was taking metformin when I conceived on Femara, when I was trying to conceive my daughter. But I can tell you that it wasn't until years later that I sort of learned about blood sugar and learned to sort of control blood sugar and to eat the right way to make me healthy. And I definitely didn't need metformin at all, because my blood sugar had sort of been healed basically before I got pregnant with my son.
Okay, so the next question we have is from Caitlin. So she's got low AMH 0.3, and all her other hormone levels are normal. She's been pregnant twice naturally, once chemical, and the second was a miscarriage back in May at 7 weeks. Her first acupuncture appointment, she had an acupuncture appointment during the follicular phase, and that led to the second pregnancy. She's on some herbs from her acupuncturist. She's been told by her acupuncturist that she's got potential kidney or liver chi, a block in that. And she wants to know, is there more I could be doing to help my body use my hormones properly? Is there anything I could do to help a future pregnancy stick? And she's afraid that her anxiety level had something to do with it not working in the past, which can be difficult if you're blaming yourself. Then she keeps telling herself to stay calm. And then she knows that the soul of her baby is waiting for you. Like we were talking about with our guest last week, Dr. Emma Brzezinski. So definitely go and listen to that podcast episode. Super helpful to be able to, especially if you're in a dark place and can't even visualize it working, to be able to connect into that, into your intuition, and be able to see things happening. Again, for low AMH, like we've helped people get pregnant with 0.0 9 AMH, and premature ovarian failure. So addressing stressors. So like we're looking at the whole body. We have a very detailed health history that we're asking people, and for both you and your partner as well, even though he may say his sperm is normal, there's always things we can do to optimize his health. Again, you want to, for sure, she didn't say anything about what she's done with diet, but definitely dig into the elimination diet. Consider going to an AIP diet. Look at the gut infections, environmental toxins that you're exposed to, and also the mental emotional side of things, being able to, actually addressing those stressors and seeing how that's impacted your relationship. And if you've got anxiety, depending if it's situational anxiety related to the infertility diagnosis or how long you've had that for. Maybe you've always dealt with anxiety, which is a key. Digging into your gut health, the health of your gut then impacts your neurotransmitters. So if you've got issues with mood, we've got a lot of people coming in that have had anxiety their whole life. And this is Brandy Buskow, the other functional diagnostic nutrition practitioner on our team. Definitely go listen to, I think it's episode 2 or 3. And she talks about her struggle with anxiety for years, and then being diagnosed with celiac disease, and she was able to clean up her diet and now able to address the long-term anxiety that she had. We see this a lot with people's anxiety really, really improving as you address those issues with the gut issues, with food sensitivity. So, if it is situational, then it could also be, getting coaching or therapy to really help you navigate this side of, the infertility journey. And if you're feeling you're putting blame on yourself, because a lot of women are a lot of pressure and blame. We blame ourselves, right? Especially if we feel it's female factor infertility, that it's all our fault. So really speaking to someone typically on the other side of this journey that can help you deal with those emotions and not push them down. Anything you'd like to say there, Justine, maybe about kidney or liver chi, anything that you're seeing?
Yeah, so there are certainly things that we can do to help support the liver and kidneys. The first thing, again, so it's always about stress, right? But reducing the stress on the liver and the kidneys, right? So it means avoiding toxins as much as we can. So plastics and chemicals and any personal care products, right, that we're putting on our skin. So deodorant and toothpaste and moisturizer and makeup. Trying to opt for the cleanest options of those things that we can, or not using them when we don't need to. So that really helps sort of reduce the load on the liver and the kidneys. But also there are lots of supplements out there. So there are herbs, and you talked about one of the herbs that your acupuncturist recommended. There are others out there. So things like milk thistle and glutathione is helpful, and phosphatidylcholine. There are lots of good supplements that help sort of clear out the sluggishness the liver and with the kidneys. But the other thing to remember is that when it comes to hormone levels being off, in almost all cases, right? So not all cases, because there are some structural issues sometimes. Most cases, the majority of cases, when hormones are off, it has to do, it's not the problem, it's a symptom of the problem. Right? So there's something further up the stream that's causing the hormones to be off, right? And so if there's a lot of stress on our body, our stress hormone cortisol rises. And in order to do that, that takes a phenomenal amount of resources for our body to keep cortisol high in order to keep us safe, right? And this is what makes us still feel comfortable and feel less pain and still be able to be alert and functioning even when there's a lot of stress in our lives. And so when that happens, our body sort of robs resources from producing sex hormones, right? So the AMH or the estrogen or the progesterone or testosterone or FSH or LSH, sort of all of those hormones get sort of robbed from, because the body just doesn't have enough resources to do all of it. And so in most cases, again, it's not sort of a fundamental problem with the organs that produce hormones. It's not with the reproductive system. It's something further up the stream. And so the more we can reduce stress on the body sort of from every angle, the more hormones have the ability to sort of fall back into balance just naturally on their own.
Yeah, I think a lot of times we myopically focus on the diagnosis and focus on the hormones, focus on egg health. And then if you look at the whole body, as you say, upstream, and kind of instead of that Band-Aid approach of let's take, a supplement to address the hormones, which you're missing. Well, why are they off to begin with? So the functional approach is looking at the root cause and what's been missed. And so the last question we have is someone's got a question from Instagram talking about her periods. So her periods were normal. They usually come for 5 to 6 days. First time in her entire life. So she's trying to conceive, obviously, but her periods are short. She thought she was getting pregnant, but after a few days, her periods would start. And so her cycle, she's bleeding for about 13 days. We get a lot of questions about cycles, and actually we're going to be recording a podcast episode that'll come out 2 or 3 weeks or so, talking about cycles and charting, really what you need to know about that, because I think a lot of this it should be taught, but it's not taught, and a lot of us don't even know what our cervical mucus means and what our period is trying to tell us, because it is a barometer of our health. So Justine, what's your take on this one?
Yeah. So without sort of knowing more information about what's been going on, it's sort of hard to predict what exactly is happening now. And so I'm not sure if she's been bleeding for 13 days or if she's bleeding at day 13 of her cycle. But in either case, right, so there are so many reasons why a cycle can get off, whether it's shorter or longer. And so not only the length of your full cycle, right? So 28 days versus 30 some days or several months in between cycles, or if we're talking about the length of your period specifically, but all of those things can be off for so many reasons. And like you said, Sarah, this is really, it's a measurement, like it's one of our vital signs, right? How your period is doing. And so it really could be a lot of things. There could be, if there was an abnormal amount of stress going on in the last month, then that certainly could cause something like this to happen. It's certainly impossible that it is possible that there was an implantation and that it didn't properly implant and that it was a conception that didn't work out. But it's also just as likely that it was a myriad of other things, right? So that there was extra stress, or maybe your diet wasn't as good for that particular month, or sort of anything along those lines. So it's not anything to be immediately concerned about, in my opinion, because so many things cause the cycle to be off. But again, the more that we can do, that we can sort of chart and pay attention to our cycle, the more information we can sort of learn from it. And that's why we're going to do the podcast on cycle charting. But essentially, there's really sort of a lot to learn from what's going on, depending on how long your cycle is and sort of all of the specifics about it, right? So I really think that that's going to be a super useful podcast. The other thing is occasionally there's implantation bleeding. So I don't know if you're talking about having bleeding on day 13, that there's always a possibility that that's what was going on as well. So I'm not completely clear from your question. But in any event, I don't think it's something to worry about, but something to pay attention to, right? And so the more that you sort of track it, the more informed we can become about exactly what's going on in your body, so that we can attempt to sort of come at it from an angle of really restoring the natural rhythm there.
Absolutely. So thanks for listening to our Q&A. And really, if you are ready to get pregnant naturally, or you want to improve the success of your next IVF, and if you're seriously considering working with us, I urge you and your partner to book a free call. You can go to Fab Fertile, FABfertile.com, and click on book a free call. Again, this call is for you and your partner if you're seriously considering working with us. We have 2 new spots available each month, and I regularly speak to about 5 to 10 couples a week. So it is very limited availability, and we're coaching couples. So especially if you're dealing with unexplained infertility, low AMH, diminished ovarian reserve, premature ovarian failure, repeat miscarriage, these are things that we regularly work with. Feels right for you. Would love to have you book a call and we can chat to see what is the plan to help you. So take care, and until next time. I developed the Step Into Your Power course because I really saw a need. We take a functional approach to fertility. We work on stressors such as food sensitivities, gut infections, environmental toxins, and more. But the theme I kept seeing come up was patience. And as someone who has struggled with the patience and control my whole life, I can really relate. I literally used to have the urge to control everything, including my journey to have a baby. But what if you just knew everything would work out? Not on your timing, but divine timing. How would you approach this journey differently? Registration is now open for our Step Into Your Power course. Go to the show notes and claim your spot. Base is very limited to 12 people. Plus, we're offering a special price as this is the beta version of our course. Just go to the show notes to claim your spot. Registration closes on Tuesday, July 21st at midnight Pacific. Melatonin is important for female fertility. It helps regulate hormones and maintain the body's circadian rhythms. Plus, it helps determine the frequency and duration of the menstrual cycle. Plus, it impacts sperm count and motility. Blue and green light negatively impact our melatonin production. That's why we recommend Blue Blocks, blue and green light sleep classes to all our one-to-one clients. Simply go to BlueBlocks, BLUBLOX.com and use the coupon code GetPregnantPodcast at checkout to receive your 15% discount. That's BlueBlocks, BLUBLOX.com and use the coupon code GetPregnantPodcast. Hey there, I regularly speak with 5 to 10 couples per week who are struggling to have their baby. And although we want to help everyone, we only have 2 spots available per month to work with us. So the Supercharge Your Fertility Discovery call is for action takers. Really people who are ready to move forward so they can finally have their baby. And if you're not ready and you wait, the risk is you'll need to wait 2 to 3 months for a spot to open up. So if you're seriously considering working with us, go to Fab Fertile, FABfertile.com and click on book a free call. Then you'll be all booked in and ready to spend 30 minutes to give you the action plan to getting pregnant naturally. That's Fab Fertile, FABfertile.com and click on book a free call. I'm excited to offer you a special gift. If you are a U.S. resident, text Fertile, Fertile, to 55444. You'll be prompted to enter your email address and you'll receive our fertility yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to our heart. These simple yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. For U.S. residents, text Fertile, Fertile, to 55444. For non-U.S. residents, go to Yoga Freebie, Freebie, to access your special gift. That's yogafreebie.com to access the free fertility yoga download. The Get Pregnant Naturally podcast, including show notes and links, provides information with respect to healthy living, nutrition, lab testing, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Get Pregnant Naturally podcast reflects the most up-to-date medical research. Information is provided without representation or warranties of any kind. Please consult a qualified physician for medical advice and always seek the advice of a qualified healthcare provider with any questions you may have regarding your health and nutrition program.